Hi there. This is On the Subject of Cancer, a podcast brought to you by New England Cancer Specialists. I'm Jessica Fidalgo, your host. Today, our guest is a lovely and amazing colleague of mine, our Row Infusion Nurse Supervisor, Anna Mendes. A quick note, while this subject may be cancer, this really is a podcast about people. Every episode, we sit down with someone who has lived through or is a specialist in the treatment of cancer, and we ask them questions about their experience. The ground we cover can range from funny to painful, awkward, and even quietly meaningful. If you're listening as someone who's been touched by cancer, personally or through someone you love, you're not alone here. Let's get into today's conversation with Anna Mendes. Anna, welcome to the podcast. Thank you for agreeing to be a guinea pig. You're my first non-physician staff member who I've been able to interview, so I'm very excited. And we're recording this during the week of Nurses Appreciation Week, which I think is kind of great. I'm not sure exactly when it will air, but I figured you were the sort of person who sprung to mind when we sort of said, like, what nurses could we speak to and pick their brains about what it's like to work at NECS and what it's like to be a nurse. So thank you for agreeing. I know this is a far cry from the stuff you usually do at work, so I appreciate you.
Hey, you got to step outside the box.
That's absolutely true. And we're next to Starbucks. You could get a latte on the way home or something like that. I have to say that when I approached your supervisor, our clinic manager, Patrick West, to just sort of say, would this be all right if I ask her and like for her to take the time and stuff, he said, oh, I wish I'd written it down. It was something along the lines of, Anna is one of the greatest nurses I have ever had the pleasure of working with. So I thought that was really nice.
It's really kind. Yeah. Thank you for sharing.
Yeah. And I know it's performance review season now, so if you want to slide that in somewhere.
Did you get that, Patrick?
Testing. Tap, tap. No, but I've only been with New England Cancer a little over a year. It's gone by very fast. But I get that impression from pretty much everyone who works with you or references you that you are seen, really as top-notch, top level. So give me your wrap. Like, where did you grow up? Yeah. Where'd you go to college? All that good stuff.
Sure. So I'm originally from Buxton, Maine, born and raised, and graduated from Bonnie Eagle High School. I knew kind of early on in my life that I wanted to go into the medical field. I wasn't really sure what exactly, but I think probably middle school, high school, I kind of decided, nursing would be for me because it was a nice balance of, kind of the science side of the medical world, but also the opportunity to, really connect with people and try to help them, meet them where they're at. And I think I settled on oncology because my father actually went through a lymphoma diagnosis back during the time that he and my mom were pregnant with me.
Oh, wow.
And he was actually treated by the physicians back when New England Cancer Specialists was the main center for cancer medicine over on Park Ave in Portland. And so he was undergoing treatment for his lymphoma, while my mom was pregnant. And the staff there actually ended up throwing a baby shower for like what turned out to be me, essentially. And so he always spoke so fondly of the people at what is now New England Cancer Specialists. And he knew the names of all his nurses. Like I can still name them, like Susan, Gina, Fern, like all those names I heard growing up. And so I was like, I would like to be able to do that, for people someday. Because look at the impact that these folks have.
That's honestly an incredible through line and incredible. I guess we can't even call it a coincidence, but it feels like fate.
Yeah. It's kind of come back around full circle.
So were either of your parents or anyone else in your family involved in medicine or career in medicine?
Yeah. So my dad's father actually was Dr. Joseph Mendes. So he was like a primary care physician in the Lisbon Falls area for a long time. So back in like the house call days. So he goes back to those times. So I think that's probably where the medical thing kind of came from.
So you kind of really started gravitating in a certain direction, junior high, middle school, high school. And then I know you went to college in New York. So you entered the nursing program straight up.
So junior year is really when those, fundamentals of adult care and pediatrics and, maternal and child care, all of those courses really start to ramp up. And it's quite busy. You're you're working pretty hard 5-6 days a week, and clinicals get started in junior year. And so that was always Thursdays and Fridays, and doing research at the hospital on Wednesday nights. And I remember being up, late sometimes, 11 p.m. to midnight.
Yeah.
We had a wonderful clinical instructor who was actually the head of the nursing program at the time. And she really demanded, excellence in all sorts of things. And she really taught us to be thorough and look into details and research. And so I think that's where, I really started to learn some of those skills that have, maybe helped me now with what I currently do. But
that's awesome. So when you say clinicals, just for folks who may not know,
sure.
Is that that's where you start to really kind of get into the nitty gritty, putting your hands on patients, learning how to, do their assessments and all that kind of stuff?
Absolutely. Yeah. So you're assigned a patient at the hospital on usually a specific ward. So where all the nursing students are on one floor. And you have maybe, depending on the patient load, you might have 1 or 2 patients that you're assigned to care for. And so you go through, you learn all about their diagnosis, you look up all their medications, you learn about what kind of care they're going to need, dressing changes, insulin, tracheostomy care, or, other types of, like you said, really getting in with the nitty gritty. I remember one of my nursing instructors saying there's no better way to get a good assessment on someone by helping them with, personal care, whether it's a bed bath or, assisting them with grooming and that sort of things. It's a really great way to start to, assess a person and see what's really, going on with them.
Yeah.
So,
that makes sense. Yeah.
So that was really nice. It was a good way, even though it was scary, it was a good way to kind of start to get comfortable.
So junior year, you said you kind of start to get into the clinicals. It's really where the rubber meets the road. And then at what point is a decision sort of needing to be made about where you're going to specialize? Because there's labor and delivery, right? There's the recovery room. There's oncology nursing, obviously. Is that something that needs to be kind of defined at some point as you're finishing your education so that you can start to, gravitate towards that? Because I know in for doctors, you do have to sort of start to, you get your match and you have to kind of like pick your specialty and then really drive towards that. Is that how it works for nurses too?
Not necessarily. I think what worked for me was I kind of already knew that I wanted to go forward with oncology. So during my senior year, I did a nursing externship at SUNY Upstate Medical University in Syracuse, New York. And so I ended up just doing it was a 2-week, like I said, externship on their oncology unit. But the beauty of nursing is that there are just so many avenues that, you could choose anything probably at any, even now, right? Like I could choose to go do something else right now if I truly wanted to. And I think the great thing too, of course, me choosing to start in the hospital was, even though I was working a lot with oncology patients, we were also working with a lot of med-surg patients as well. So you got to see, other things, other types of, maybe illnesses and things that people need help with. And so that's the beauty of nursing, is that you don't have to maybe know right away what you want. You could just kind of pick something general and,
that is really
see
nice.
What maybe piques your interests, or, spend a year or two working in a certain field and then decide like, oh, maybe I'd like to try outpatient, or I'd like to, I'd like to go to cardiac rehab or something like that. It's just, there's a lot of opportunities to move around.
That is really nice, cool. That it has that flexibility and the skills are so transferable. So are you married? I don't know much about your...
I will be in like 3 weeks.
Why did we not open with that? That should be on the list. Congratulations.
Oh, thank you.
That's wonderful.
Yeah,
oh my gosh.
you.
Here you are in the middle of wedding planning and you're agreeing to sit down and answer all my dumb questions. That's amazing. Will it be here in Maine?
Yes.
Okay.
We're going to get married locally in Portland.
Wonderful.
And
That's
thank
great.
you.
Congratulations. I'll be praying for good weather for you. That's
thank
always
you.
the biggest sort of question mark, I think, in summer in Maine is like, will it rain? Will it not?
That would be great, because we're actually getting married on a boat. So we're really hoping
Perfect.
for
That's
weather.
awesome. All right. So we're up to graduation and you talked about your externship.
Mm-hmm.
And then you kind of started in a hospital oncology unit professionally, like your first job.
Yep.
So what did that look like?
It was great. It was hard. I'm not a night person. I definitely like going to sleep at normal times.
Me too.
But The cool thing, though, with night shift is that you really do learn a lot by being working in those hours, because you're kind of just there with your team. And yes, there are doctors and people, around, but, the primary medical team isn't making rounds at that hour. So, you really have to learn to, assess your patients well and pay attention to things and sometimes, be resourceful with who you have around you. So I really enjoyed it. It's not something I could have done forever, but I worked with some really great people. It really felt like you're kind of a little odd on night shift. I don't know if anyone watches The Pit, but
my daughter does. She's obsessed.
But when Dr. Abbott, at the end of the last season here, just, kind of does his little group thing with the night shift people that are all coming on. It's like that kind of what it felt like a little bit,
Yeah. I've heard people say that show is very accurate.
Yes.
Yeah.
Yes. It's probably one of the more medically accurate shows I've seen.
That's cool. I'm going to have to check it out. A lot of people have been pulled in.
Yeah.
Okay. So I'm particularly interested in kind of what you were saying a little bit about oncology nursing and how it is differentiated from other types of nursing, even though a lot of the skills are the same. What do you think makes for a good oncology nurse, or specifically even infusion nurse, which is, we can talk a little bit about like what that job looks like, specifically at New England Cancer, since that's where we work.
I think one of the unique things about being an infusion nurse is you're handling, multiple patients a day, and ranging from anyone that's maybe starting a brand new chemotherapy to maybe someone that's sitting down in the chair next to them who's getting some IV iron, So you're really having to kind of switch hats, I guess, kind of, and really read the room, read the situation, really look at the person that you're working with at that moment, because it could be something completely different from what the person next to them has going on. So just really being able to be in tune with that.
Read the room.
Clinical skills, critical thinking, those are really important, because, patients that come in for infusion, maybe they've seen the provider earlier in the day or maybe on a completely different day altogether. But being able to assess what's going on in the moment with that person, and, maybe they're reporting a new symptom, or they'll say, I forgot to mention to the doctor that I have this going on too. So being able to kind of, step in and assess and, help make some clinical judgments and then reach out to the appropriate resources.
So kind of a perceptiveness is key.
Yeah.
So for our listeners who are maybe not plugged into the world of cancer treatment and so on, we at New England Cancer have infusion rooms. I think they're called bays.
Yes.
So an infusion might mean chemotherapy, right? Or it could mean an immunotherapy, which is maybe related.
Yes.
Or like you were saying, there's iron infusions. Are those basically the types? What else is there?
So we also treat actually folks kind of all over the community. We do a lot of infusions now for autoimmune disorders like Crohn's, people that have chronic migraines, multiple sclerosis is a common thing that we provide treatments for. We also treat patients with high levels of iron. So we do, special types of, phlebotomies to help with those high iron levels. And we do a lot of supportive care as well. Hydrations, anti-nausea medications, antibiotics.
Okay. I had no idea there was such a range.
Yeah.
That's impressive. So for folks who are not being seen by an oncologist in New England Cancer, would that be like a referral from another practice for infusion? Is it almost like getting lab orders that you kind of take with you?
Yep.
Okay.
Yeah. We work, I think, with a lot with different neurology offices. Probably, gastroenterology, GI doctors.
Right.
So yeah, I think we work with a lot of folks around the state.
Yeah, that is a pretty incredible range. So out of curiosity on my part, have you started to develop a real, I'm sure the answer is yes, but have you started to develop a real familiarity with all of these different types of drugs?
Yeah, we've got some great resources. A lot of the drugs that we give, we give them a lot, so you kind of get used to things after a while. But We have a great team of pharmacists that are always available when we have questions, or if there is a new drug that's going to be coming out. They're really good about communicating with us and providing us resources, education handouts. And we actually have a clinical educator now on staff, a clinical nursing educator, I should say. And so that's, I think, another great resource, another person, that we're able to tap into and, look to if we need education on something new. And there's always something new in the world of oncology. It feels like things, there's so much research and, things like that going on right now. And
it moves very
ever changing, or, certain medications get approved to, now treat a different type of cancer. And so that's always really interesting to learn about. It's a very, very fast moving world.
Which is exciting, but also, a lot. Okay, so talk me through how it works when we get a patient into infusion.
Mm-hmm. So usually their nurse will get over there within a couple minutes just to greet them, introduce themselves, orient them to the room. I think that's kind of a great first way to just say, like, okay, here's where you're seated. Here's where our restrooms are located. Here's what we have available for snacks and drinks. Here's how the pole works. Here's how your chair works. Kind of get them comfortable with their immediate surroundings. And I think a lot of our staff, understand that, hey, maybe this isn't a place that you want to have to come, but we're going to do everything we can to make you feel comfortable and aware of what's going on. So I think that's where most people start. And then a lot of us kind of like to talk through and explain, like, all right, so I'm going to go do a double check on your orders. One of my colleagues is going to do the same. We always double check everything that's, chemotherapy related. And then only then do your orders then get sent to the pharmacy to begin to get prepared. Okay. So we've got multiple eyes on everything. We're going through, your chart, consents, all of those things. We have a kind of a varying range of lengths of infusions, but people can bring visitors. We have, visitor chairs at each of our bays. Mm-hmm. We have quite a few window spaces, which is really nice. So there's a lot of like nice natural light. And there's curtains if people just want a little privacy. Mm-hmm. You can draw the curtain if you just want a little quiet space. We can dim the lights for you. Mm-hmm. Warm blankets, those are always a hot sell. Yeah. I think, so we do what we can to make sure that if you have to be there sitting for whatever reason, doesn't matter if you're there for chemotherapy or, getting an iron infusion or, we want to make sure you feel looked after and comfortable in the space. So.
And you have like a little, I'm assuming like a button if you, or if you're urgently needing to get someone's attention.
Yes. All the chairs have emergency lights. All the bathrooms have those, pull cords. So yes, if there's anything emergent going on, someone's not feeling well, yes, people can absolutely press that and we'll come see what's going on.
So if someone's receiving, let's say, a chemotherapy drug, for the very first time, this is their first rodeo, they don't know what to expect. What are you as an infusion nurse kind of like on the lookout for?
I think all of my staff are really good about educating patients, just to let us know if something doesn't feel right, kind of do a full body scan. How are you feeling right now? And if things start to feel different, if you start having symptoms like, feeling hot or itchy or pain in your body that you don't normally have, I'll always say to people, if something doesn't feel right or doesn't feel like your usual, let me know, because we'd rather hear about it and have it turn out to be okay. Or maybe it's just, something else is going on. We'd rather know about it and address it, rather than have you try to, muscle through, as a lot of Mainers sometimes will do.
Especially the older ones.
People like to sometimes muscle through things. So don't muscle through. Let us know if something's going on.
Don't be a hero.
Right. But the good news is our staff are really prepared because there are certain medications where maybe we're a little more on alert for, a sensitivity to it or a side effect. And so we're prepared ahead of time, to manage that sort of thing if it were to happen. We have a response plan, I guess, if you will.
So how many nurses are you supervising at NECS?
I have 21. Yes.
That's a big number. Yeah. So I'm curious about our human connections with patients and kind of the emotional piece of it.
Yeah.
Because cancer it's a big one, right? It's probably at least in the top 5 of most people's worst fears. And I'm sure that we must see a range of folks from someone who is very, sort of taciturn and not wanting to really chat or engage to folks who really might want to take up more time than you have available to sort of talk about what's going on with them and process some of that out loud.
One of the privileges of doing what we get to do is we do get to meet all kinds of people. And I think when we meet someone, especially if they're brand new, right, coming in for treatment, we're always going to look to try to meet people where they're at, encourage them to express themselves, ask questions. If they have concerns or worries about things, like we always want to make sure people know that we're listening. And even if I don't have the answer, or my staff doesn't have an immediate answer for you, we're going to work to help you and support you and get you resources that you need to help manage whatever's going on. And I respect too that for some people, cancer is, maybe a private journey. I know there's a lot of ways for it to be public and get involved and, get your voice out there and kind of do all these things with it. But we respect, people's like, hey, maybe you just want to come in and you just want to get your treatment and go home. And that's okay too. You're still going to get that same love, support, and care from all of us, no matter what your approach to this is.
So it's a range. It's really quite a range. And then, is there do you have that flexibility or availability as an infusion nurse if someone really, I'm sure if someone's, sort of pouring their heart out, you don't want to be like, hey, I got to go deal with this other person, How much flexibility do you have to be able to kind of sit with them as long as they want to talk or?
We have pretty good flexibility for that. One of the beautiful things about my team is that it really is a team approach. We've never been those people that are like, oh, well, that's not my patient. I'm not going to go help and do something or get this patient started or go get vitals. Everybody is really good at keeping an eye on each other and seeing what's going on. And, we see that maybe someone's busy with the patient and it's like, oh, we've got to go get maybe this person started. People are just going to dive right in. We have usually have at least a float nurse out to help too. If, something is taking up a little more time, we're going to be able to dive in and assist other patients too. So people are really in tune with what's going on in the room.
Nice.
So
I've definitely gotten that feedback from patients that, they feel very, seen and kind of personally, individually cared for at our practice, which I think is something to definitely be proud of. You've been in oncology nursing now for a little over a decade-ish?
Yeah, since 2009.
Yeah. Oh, wow. Yeah. So going on 2 decades.
Yes.
And we talked about how the science and just kind of the process of oncology treatment is really rocketed, in terms of pace of change and things that, new research coming out and all that sort of thing. What do you think is kind of the biggest, what would you say is the biggest change you've seen in your career so far in terms of oncology care or treatment or anything about cancer?
I think one of the coolest things I've seen is honestly some of our treatments being able to be moved to an injection form. I'm thinking of one drug in particular that when I first started with New England Cancer Specialists, the medication used to be given over like 2 days with all sorts of pre-medications, things to help prevent reaction or side effects. And we've now moved from that medication being given over, that length of time to now just like an injection that takes just a couple minutes to administer, and then the patient can go home. So yeah, that's probably like just one of the neatest things is seeing some of these changes that not only get the patient what they need, medically for treatment, but also like gets them back out, gets them out of the chair, right? Gets them back home, gets them, or, back to work,
back in their day.
Back in their day, and being present with all of those other really important things. So yeah, I'd say that's probably
That's
one of
very
the big
cool.
things. Yeah.
I'm very fascinated by, kind of the trajectory of, typing the cancer's DNA and sort of being this really individualized approach to certain diagnoses that seems to be just moving at a really rapid pace. It's very interesting to me.
Yeah, there's a lot of medications now that are, specific for, certain mutations, right? So we can, more now than ever before, cancer treatment has really been able to be more personalized, right? So we're, going after the cancer, but leaving other things intact that don't make you feel, yucky or, nauseous or fatigued all the time. Like, it's pretty incredible what they've been able to, do for research and say like, hey, we have this new medication now that will target, this specific protein or this specific mutation. And it's pretty incredible.
It really is. Do you feel optimistic about the future of cancer treatment?
Oh, for sure. And just in seeing too, the options that people have, like we've seen cancers where, maybe there was just one or two lines, or one or two regimens that maybe would work. And now we have multiple options. If one medication doesn't work, we've got something else we can try. We've got another approach. And so I feel really hopeful for people. It's been really neat to see these last few years.
Yeah. Science is incredible. So we started to talk a little bit just about the idea that oncology can be a fairly heavy experience obviously for the patient, but for the caregivers and for, clinicians as well. I imagine that you have met hundreds of incredible patients over the years that you've worked with, and I'm sure that you've lost some. Are there specific ways in which you try to care for yourself emotionally or really, process those difficult days so that you can kind of show up to work the next day and keep it moving?
Yeah. I think just having good, healthy outlets outside of work. I'm really fortunate to have, good family and good friends, other nurses that I can connect with, if I've had a tough day and then keeping myself active, going outside, riding bikes, swimming, being by the beach, playing board games, just finding things to kind of, like with any job, right? You need to be able to disconnect. And I'm really fortunate to have some great outlets when it comes to family, friends, coworkers. Sometimes we'll go out and have just go get a drink or have a snack or something after work. I'm fortunate enough to have, my soon-to-be husband, we like to travel and hang out together, watch sports, play board games. I'm really fortunate to have things to do and activities that I enjoy that, help me channel that energy. Or if I've had a tough day, I have somewhere to go or something to do to kind of help work through that and process it. I try not to hang on to things too much because any job would have this, I'm sure. You have tough days and, sometimes it's easy to get weighed down by negative, tough things, negativity and things like that. But
I noticed that you are wearing a Dempsey Challenge tee for our interview today. Yeah. Is that something that you've participated in the past?
Yes. I did it last year for the first time. Super fun. Definitely recommend getting involved with it. It's a really wonderfully run event. And I love that it supports people, in ways beyond just, medication, right? We're helping, with yoga and cooking and maybe therapy and support groups and like all these things that kind of help everything else going on around the person.
Yeah, absolutely.
And the family too. That it supports family. So I love it. Yeah.
Have you ever met Patrick Dempsey?
Yes. I have a picture with him.
I do too. I look insane.
Yeah. But yeah, he's done wonders, I feel like, for the cancer community.
Absolutely.
And I think it's wonderful that he uses his time and energy, really generously to help give back to, the state. And he shows up for it every year.
He does. He's not just signing the checks, people. I was listening to a story the other day about, it was from a comedian actually who was performing at a comedy club, I guess, but there were more comedians than just them. Anyway, during their set, someone keeled over and at the table, and the comedians got the microphone, of course, and they are going, is anyone here a doctor or a nurse? And a nurse hopped up and ran over and assessed the person and had someone call 911. I was just curious, since I knew I had this interview coming up with you. Has anything like that ever happened to you? Have you ever been on a plane where they're like, we need a medical professional?
Not an airplane, but this is when I lived in Syracuse. I was actually at my hairdresser, just getting my hair cut, and I was paying for my haircut. And the husband of one of the salon owners had come in, was like eating some pizza, and started to choke on the pizza. And so I ran over and like did the Heimlich maneuver. And he, I think, I don't remember what happened, if he swallowed it or spit it out. I kind of blacked out. But he was okay. And it was like, so yeah, I guess that instinct, that training, kind of kicked in a little bit.
It just kind of kicks in. That's amazing. Good for you.
Oh, thank you.
Did you get a free haircut after?
No. No, I didn't. That's okay, though. That's okay.
All in a day's work. That's a good story. I'm glad I asked. I'm going to ask that from now on anytime I meet a clinician. We didn't really get a chance to talk about, too much about specific patient experiences and things like that. I mean, of course, a lot of that is protected information, of course. But if there's any kind of like story or anecdote that you had brewing that you wanted to share, we'd be more than happy to like get into that.
Yeah. I had a really cool opportunity to work with a patient and her husband, and kind of a long story short, someone that we worked with, kind of consistently over the span of maybe a few years. And of course, you just start talking to people, right? It's like, yes, they are a patient, they're coming in for an infusion, but you don't really talk about the cancer that much after a while. You're kind of just like people. You're just like talking about your lives, and so kind of a long story, sort of short here. Ended up finding out that this patient's husband actually graduated high school, Brunswick High School, class of 1951, with my grandmother. And so he had the yearbook, and ended up bringing in the yearbook for me to look at. Amazing. And see, like, oh my gosh, here's my grandmother, on the debate team, and as a cheerleader, back in the day. And
That's incredible.
It just was really, it was really neat to forge that connection. And I think it just speaks a lot to the humanness of what we do. And it's like, yes, maybe this person is coming in and they're sick and they're not well. There's a whole reason they're coming here. But then we get to, address that, treat it, and talk to them and interact with them as people.
Yeah, really get to know them. That's incredible. Was your grandmother still alive at that time?
Yes, she was. And
did she remember him?
Yes. After seeking permission to be able to share, certainly first before making any, going beyond the doors of disclosing that. But I was actually able to take the yearbook home and show it to her. And there's actually a really sweet picture of her sitting in the chair, like me next to her looking at it, and, and she's just looking through it. It was really unique. That's never happened to me.
I love that.
Anywhere else.
I love that story.
Yeah.
Do you ever, a lot of patients that we work with go on to sort of, graduate from treatment or receive, a cure or go into remission, and they're not coming to infusion any longer. Yeah. Do you have patients who still keep in touch with you after they leave our practice, or?
Yeah, sometimes, if they just come in for routine follow-up, they'll pop down and say hello, which is wonderful. I'll always say to someone on their last day of treatment, and we'll always say, this is in the best way possible, but we don't want to see you here again. There's always a better place to see you, outside of this joint. But actually just a couple weeks ago, a patient that we treated, got a cure, was just coming back, just for routine follow-up. I hadn't seen him in a couple years, and it was just like, oh my gosh, how are you? How's the family? And it just, I don't know, it was really, special to be able to see people come back around and, stay connected.
Definitely. Definitely. Well, it's definitely a testament to you and to the care that you give that people, want to do that. So
thank you.
On behalf of all our patients and staff, thank you.
Yeah, thank you so much for having me.
Oh, you're a great sport. I really appreciate it. I really appreciate it.
Yeah.
Thanks for listening to this episode of On the Subject of Cancer. If you're listening and heard a piece of yourself in this conversation, whether you're a survivor, a caregiver, or someone still finding their footing, we're glad you're here. Cancer can be isolating. Conversations like this one with Anna remind us that even when the experiences are different, the feelings often aren't. If you have a topic you want us to cover, please send us a note to onthesubject@necs.com. This has been On the Subject of Cancer. Learn more at newenglandcancerspecialists.com. If you're listening to this podcast before June of 2026, New England Cancer Specialists is hosting Beyond the Ribbon 2026, a celebration of cancer survivors on June 14th at the Sheraton Sable Oaks in South Portland. Learn more about this no-cost event by going to the events page on our website, newenglandcancerspecialists.com.